Morning, everyone. My name is Merritt Green. I'm with the law firm General Counsel PC. Here with us today is Tracy Michaud, who's a Consultation Program Manager with the Virginia Department of Labor and Industry. Today, we're going to go ahead and talk about the Virginia Emergency Temporary Standard, go through some of the executive orders that have occurred, and generally give guidance for businesses on best practices, legal requirements dealing with the ongoing coronavirus pandemic. So just very quickly, let me give a little overview about General Counsel PC. We are a law firm, a full service law firm that was founded by me back in 2004. We are legal counsel to small, medium-sized businesses, nonprofits, and individuals throughout the DC metropolitan area, throughout Virginia, and we also represent a number of foreign businesses and other businesses in their operations throughout the United States. We have 4 primary practice areas. We do significant corporate M&A practice, day-to-day contracts, anything that the business really needs from an ongoing business matter. We do significant labor and employment law, handbooks, advising companies on COVID issues, day-to-day compliance matters, anti-discrimination and the like. We have a full government contracts practice representing government contractors, and we do dispute resolution litigation throughout the state and helping employers with litigation matters. So that is a little bit about us. Just very quickly, and for right now, and for this only, since we found that cameras can sometimes be a distraction, Tracy and I are both going to turn on our cameras and wave and say hello, so you can put faces to the voices. So we're both going to wave and say hello. So, and then from there, we can both turn our cameras off. Having said hello, just quickly, I'm going to talk about the November 16th executive order. So this came out on the 13th. It was effective at 12 a.m. Monday, November 16th. It is a tightening of restrictions on businesses and throughout Virginia as it relates to increasing COVID infections throughout the state. As you can read here, public gatherings were limited to 25 individuals, down from 250. Different businesses have different restrictions that are being put into place. So fitness and exercise facilities, occupancy must be limited to 75% of the lowest capacity. Masks are required for all Virginians aged 5 and over in public spaces. It is a Class 1 misdemeanor if these guidelines are not followed, within essential retail businesses. Alcohol sales are prohibited after 10 p.m. and restaurants, etc., must close by midnight. So there's a general tightening of restrictions trying to protect the population. There are specific directives for a number of the following industries: restaurants, farmers markets. I'm not going to read through them all, but you can read through them. If you are in business here in Virginia, you should look through the executive order, see if there are any particular directives for your business, and see how it is impacting your business and what the best practices are. Not only as it relates to this executive order, but as Tracy will talk about the temporary standard and the requirements that all businesses have to do for that. So with that introduction, I'm going to go ahead and turn it over to Tracy because we really want her presentation to be what we are concentrating on today. If you have questions as we go along, and I'm going to go ahead and make Tracy the presenter now. There is a questions tab within the tool section of the GoToWebinar. Go ahead, post your questions there. As Tracy finishes her presentation, we'll go through those questions. I already see that we have 2 or 3, and a few people emailed me questions beforehand. So we'll leave for at least 15 minutes for questions, and hopefully try to complete this by 11 o'clock out of respect for everyone's time. So with that, Tracy, I turn it over to you.
Good morning, everybody. I'm Tracy Michaud. I work for the Department of Labor and Industry. I am the Consultation Program Manager. So I am the good side of VOSH. I go out and I help actually employers with their programs. We have consultants throughout the region. We're going to talk about the emergency temporary standard today. If there is questions, as Merritt said, just please let me know. So the first thing is, I'm trying to get my slide here. We're going to cover important dates of when it went into effect and what you have to do by certain dates, why we have it, the VOSH response, risk levels, employer responsibilities, compliance, infectious disease preparedness and response plan, training, and then we'll do the Q&A at the end. So the date, July 27th, 20 is when it became effective. And as soon as it was signed, it went into effect. August 26th was the date that employers had to have employee training requirements as per the Part 80. And we'll talk a little bit about that. The next date would have been September 25th, which if you are required to have an infectious disease preparedness and response plan, you were supposed to have your training for that done by September 25th. And September 25th is also the plans and the training completed. So there's two separate things. You have your plan and then you have your training completed. And then it expires 6 months after it was signed, which would bring it into July 27th of 2021. Now, currently, the Safety and Health Codes Board is considering the adoption of a permanent replacement. So we've had public comment on it, and the board has met, and they're still discussing it and what they're going to do, changes, and everything based on that. We have a lot of questions that have come in, and based on the questions and the answers and the public comments, they've kind of revised some things onto it. I can't tell you everything that they revised because I don't know that information, but there is some stuff that has been revised. So the VOSH Emergency Temporary Standard, what does it do? It actually prevents the spread of the virus. That's our whole goal, is to prevent this spread. As we know, it's starting to increase in numbers again, so we want to prevent it. And it applies to every workplace of employment within the jurisdiction of the VOSH program. So it doesn't matter if it is a little mom and pop store or it is a big, huge company. It applies to anybody where VOSH regulations and jurisdiction apply. And it's based on your exposure risk levels and the hazards present or the job tasks that are being done. So you have very high, medium, and lower. And it depends on what your risk level is and what you assign to them. That is what you have to come up with and how you distinguish what type of training is needed for people, okay? So the higher the risk, the very high, you have more training. You have to have the infectious disease plan. If you're low level risk, you don't have to have all that stuff. You can hand them information and talk to employers on it. And we'll talk a little bit about that. So currently the VOSH response. In Virginia, we have had 28 fatalities, and this was as of 11/6/2020. So this was the beginning of November. Since then, I haven't been able to get the information yet. They're still compiling it. So we've had 28 fatalities. There's been 59 hospitalizations that resulted in 20 inspections. So when they report that there was a hospitalization, then we determine if we need to go and do an inspection or not. And the 59 hospitalizations resulted in 20 on-site inspections. We've had 1,285 complaints where employees called to complain about something at their employers not protecting them and stuff like that. We've had 81 inspections that as a result of a death or hospitalization or a complaint. So 20 based on the hospitalizations, okay, 81 inspections based as a result of the death, a hospitalization, or a complaint. And we can go, if there's a complaint, we can actually go and do an inspection then based on what we get back. The biggest number is 8,888. It's kind of a strange number, but that is the total number of phone calls that we have received and fielded from all the offices and all of the employees. So how do you determine your risk exposure? So you have to take into consideration the tasks that are being done, the work environment, if the virus has a presence in the employment area, the number of employees and the size of the area, your working distances, the duration, the frequency of exposure, and the hazards encountered. So you can have one job site, and on that one job site, you can have multiple risk levels. And you've got to be careful that you don't have cross-contamination, which is a big thing. But say you're working at a nursing home, you might have a very high risk with the nurses that are going into the patients that are possibly known to have COVID or positive for COVID, but yet you've got a maintenance person or an office worker that never goes onto the nursing floor. So he could be considered low exposure, but yet you've got the nurses that are very high. So you have to do training for each of those types of people and job types based on what they do. It's not everybody gets this training and that's it. It's based on what their exposure level is. And if you look, the CDC just came out with a new definition of what the duration and frequency of exposure is. So you're going to want to go and look at that and see. It's so many minutes in close contact, I believe, is how it's determined.
So Tracy, quickly, and this is Merritt, quick question
Sure.
for you there. And this is something that's
Yep.
come up a number of times in the last few months. So if you have a company, let's say it's a construction company, and they have
Okay.
office staff and then field staff. And the office staff is, their accountants, they're doing, they're in the office, they're not going out and about, clearly a, lower level. A number of them are probably even teleworking still, low risk. And then they have, other folks who are going out to job sites, interacting with, customers, most likely a medium risk, under the VES standard. What should that employer be doing? Does it need to implement the medium standard across the board? And let's say they have a total of 50 employees, so they have that higher standard that they implement for the lower risk office folks, or can they implement sort of two standards? What's the best practice for them in that circumstance?
For the best practice for them, if the people are in the office, they have no exposure, they are considered low risk, you implement just the low risk standard for them. That's it. So you would go, and there's information on our website that you can print off. You give them the information about how COVID's transmitted, how to protect themselves. They're following the social distancing. They have barriers in between their workstations. You've done everything possible to eliminate their risk, engineered it out. The people that are going out on the construction site, they are exposed to all kinds of people. They would be the medium to high risk. You would do their training based on that. So you could technically have the two different ones. You're not going to want to do high risk, medium risk training on your lower risk ones, only because it's not needed. Why do training if it's not needed? It's great information. They can sit in on it. There's nothing saying you can't do training on them and you can't train them to the one standard. I find best practice, train what is required. If you train more, especially in this situation, either you're going to scare people, you're going to waste time as doing this training, and they're like, yeah, we have to go through this, and it's not even required. Why are we doing it? They're going to get that attitude like they don't care. If by some chance they do go out into the field and they go onto a job site, that changes their classification. So they're going to need that other training. So you've got to really look at the risk and do your hazard assessment of the job to see what their exposure is. Whether they go out one time or they go out multiple times a week. Does that make sense?
Yeah, that's great. Thank you.
Sure. So the employer responsibilities. The employer has to protect your employees. That's the number one thing that VOSH is behind, no matter what it is, whether it's a temporary standard or not. You have to protect your employees. In order to do that, you have to perform your workplace hazard assessment to identify your risk level. So once you identify your risk level, you have to develop a written plan to protect your employees, and you have to implement your controls. So that includes your social distancing, your self-monitoring. A lot of companies have an app that they go and they self-monitor every morning. Hey, I don't have any of these symptoms. You need to post signs. Going into break rooms or in common areas, you need to post signs the capacity of the room. You need to post signs on what's required for hand washing and sanitizing. You need to post signs on basically clean up after you're done. You need to have PPE in use. So you have to supply them with the PPE, whether it's a respirator N95, it's the full PAPR respirator, gloves, you need to supply that stuff. Access to sanitizers and hands and or water and soap. You need to make sure that's available throughout the sites and the facilities. Common areas, make sure you have signs that say, hey, when you come in, before you leave, make sure your hand sanitize. Most places have it at the doors now when you walk in and when you walk out. You have to train your employees, again, based on what their risk level is. And you cannot permit workers with known or suspected to have COVID-19 to remain at work. That includes your contract workers, temporary workers, and subcontractors. You need to have some type of a policy in place that says to the employees, hey, you need to report it. This is how you go about reporting it. It's a lot of little stuff that you have to have. And you have
Tracy,
to report.
I'm sorry, this is Mary. Quick question again about what you were just talking about. Something else that I've seen a lot of employers struggle with is, and I'm not sure this is sort of within the realm of how you're advising employers, but it's hard to tell an employee who's not feeling well to go home if they're potentially not getting paid for that time.
There is, yeah.
So do you have any recommendations in that regard, or you have a contractor that is providing a service to the company and telling them not to come on, or you have employees who you're telling, sorry, you can't go into the office, and they're an hourly employee, so you pay them $10 an hour, and you say, and we're not paying you today? And the employee says, but I want to come in. And the employer says, well, you have a fever, or your spouse, was diagnosed with COVID.
In that case, you want to have in your policy information about teleworking options. Hey, if my wife or husband was exposed, I can't come in because I might possibly have an exposure. Offer liberal sick time, vacation time, telework options. You have to kind of work with your employees to see what's going to work. It's hard for me to sit and say, hey, don't come in, you don't feel good, here's $10 an hour, I'm still going to pay you. But that's kind of where it's coming down to. You got to offer and educate the employees on the sick time, the Family Health and Medical Acts and stuff like that. It's not an easy thing. And especially some contractors, they won't tell you because they don't want to lose out on the job. But yet they can spread it to all these people. So it really goes down to educating the employees and your contractors as to why they need to tell you and what you're offering them. Does that make sense?
No, I think that's right on. And just so from what I've been seeing and working with clients for the last several months on these issues, is it's really an intersection of, legal responsibilities that you have as an employer through the Virginia Emergency Standard and otherwise, practical considerations and making sure your employees, and clients are safe. The last thing you want is an outbreak that potentially shuts your business down, or that you have employees that are getting sick or dying, and then the intersection with that, with state and federal employment laws. So we have, the Families First Coronavirus Act that provides benefits for employees with COVID or other COVID-related matters. And then we have federal laws that have been around forever, Americans with Disabilities Act, the Family Medical Leave Act, that provide rights to employees also. And I think that's where it's been most complicated for employers, is sort of putting all of this together with these legal requirements, practical considerations, looking at state and federal laws, the Families First Act, the Americans with Disabilities Act, the Family Medical Leave Act, and then making sure their businesses keep working. For a lot of businesses that are more white collar, you can telework. A lot of businesses can't telework. Whether you're manufacturing, restaurants, or something else, it's hard. Mm-hmm. And that's where the struggle has been. And that's where, we've had a lot of clients that have contacted us for help to sort of navigate through that. Tracy,
it is a struggle. It is very much a struggle. And that's why when you're educating your employees on why you have to go through all this, look at the engineering ways that you can hopefully engineer some of the exposures out of the 6-foot social distances. Like some assembly plants, they've got an assembly line. They put plastic barricades up between each position. They're movable, as in they're on a frame. They can wheel them in and wheel them out, but they're still the barriers that are keeping people safer. Yes, you have to be there. You have to do your job. You don't feel good. I get it. You can't work from home, but also having the sick pay and stuff like that, that helps prevent them from coming in and makes it so they don't worry. That's a great benefit to have.
Yep. And what I've heard, just really quickly, talking to hundreds of employers, and I've done a number of these seminars, is the number one thing that employers really need to do is really have flexibility through this. We all hope and pray that there's an end in sight within the next several months. So it's flexibility to protect the company, but also protect and work with your employees getting through this.
Yeah, that's a huge thing. Definitely. Reporting. VDH, you have to report each positive case to the VDH, the Virginia Department of Health. They're the ones that are tracking. Everybody sees the dashboard that the governor puts up. You have to report a positive case at work. Now, if you have 3 or more employees present at the place of employment within a 14-day period testing positive, within 24 hours, you have to notify VOSH. And we've actually created a online reporting system that you can go and do it right online. But you have to report that to VOSH.
And Tracy, Mary, again, another question. The reporting obligation, is the reporting obligation just if an employee contracts COVID, or you believe they contracted it at the workplace?
It has to be they contracted it at the workplace. So if somebody comes in and says, I tested positive for COVID, obviously you're not going to let them work. You need to send them home. But you need to fill out the accident reports in your investigations to determine, did they do it at work? Did they contract it at work? And who was the possible exposures? So that's why it goes back to your whole contract tracing. You need to know who you exposed to.
But for an employer, that's so hard. Just thinking through it practically, let's say it is an architecture firm, and they're trying to have some of their folks come into the office because they work collaboratively, but they're being socially distant and wearing masks within the office. But they have 15 employees, and 10 of those employees have children that, a few of them are in daycare, and some of them have had family reunions. How do you know whether or not it possibly was contracted at work, especially if it's only one employee that has it?
Yes, exactly. It's very hard to do that. But if you look at, if no other employee at work contracted it, most likely they didn't get it from work. Most likely you can tell from a person, okay, who were you with that has tested positive? So, example, I go to my church and somebody at my church tests positive. They let me know that they tested positive. I haven't been to anybody else. Okay, so now I know that I got it there. So as you're saying, they're in an office, the one person tests positive. Okay, who else do you know that has tested positive? And you can do process of elimination almost, but you still would want to, all costs, on the safe side, notify VDH.
Okay. So even if you think that it's most likely that the person got it from going to church, that employer with the one employee who has COVID, you would still recommend notification?
To VDH, I would.
Okay,
you don't have to VOSH because you need the 3 positives in 14 days.
Excellent.
Does that make okay? So your sick leave, telework, staggered shifts. We talked about the assembly line and your employees that still want to go. The sick leave, staggered shifts. You might have to extend your shift. So instead of being done at 5, now you're done at 6, and you kind of spread people out so they're coming and going at different times, rotated around. You have to really think outside the box a lot of these times for this type of stuff. Again, inform the employees of the policies, which I think Merritt covered with the Families First Coronavirus Response Act. Provide the policy for self-reporting and monitoring. Make sure you have documented return to work procedures, whether you're doing it based on time or you're doing it based on positive test results. Make sure it's documented what you're going by, and for reporting positive results. Notification of positive tests to all exposed employees. So if you have, basically, you have 50 people and only these 10 people were possible exposure to this employee, you notify that 10 people. Let them know, hey, there's a possible notification. If you are renting a building, you have to notify the facility owner. A lot of the buildings, like in downtown Richmond, they have multiple departments in there. You have to notify the owner so the owner can notify anybody else on that floor or who might possibly be infected or contacted it.
And Tracy, real quick, sorry for keep asking you questions, but the
it's okay.
Return to work policies, and I'm not sure of asking questions that I know we've had clients that have really struggled with these issues. So I have to be honest, I know the answers to a lot of these things, but I think they might be beneficial for other folks. The return to work policies. Can you provide a little bit more detail on what you recommend in that regard? So you had an employee with COVID. I know that there were sort of two types of return to work policy, one based on time, one based on testing. What would you recommend now that most employers do, and where can they get the documentation?
You can get it off of our website that has information about return to work, the coronavirus website that we have out. I don't have a good recommendation as it's what works best for everybody. If you want to do time-based, or you want to do symptom-based, or if you want to do test-based. Some employees won't take a test no matter what, so you can't really do that. But that's why you have to put it into your policy of what it is. You need to get something written up, and that would be an HR question as to what you can allow because of HIPAA. So, do you want to send them to your doctor that you use for your pre-employment physicals and have them tested there? Is it a condition of the employment that they actually take the test, or are you going to go symptom/time-based? There's not one better than the other that I'm aware of at this point. It kind of goes back to what your company wants to do and what your employees are going to do. So if it's documented as this is our policy, this is what we're going to do. We are using time-based. You test positive, fine. 14 days, no symptoms, no signs, no fever, no nothing, come back. The CDC has some great information on return to work policies and procedures that you can kind of take and manipulate to put into your programs.
Absolutely. Thank you.
Does that help?
Absolutely.
Okay. Social distancing, signs. Make sure you put signs on the floor, on walkways, any place you think that there's people going to be. If you're in your common areas, like your lunchroom type deal, take some of the chairs away, mark them off, put signs on the floor saying if you're standing at the microwave, you can't stand here. Put a box around that 6-foot area from the microwave to announce it, or to people give it a site thing. I lost my whole train of thought there. Sorry. Verbal announcements. If you have a PA that's playing music or whatever, cue in some verbal announcements. Hey, promote 6-foot distancing. I'm sure everybody's gone to Walmart or the grocery store and you hear all the time in the back of your mind, them subliminal messages that come through, they just start ingraining into your head. Use that. Play it over the recording so people see. And again, put pictures up, signs, whatever you need to do to promote the social distancing. One-way walkways are really great in manufacturing places and offices. If you have rows and rows of cubicles, have them go up one aisle and down the other so there's no crossing within the 6-foot walkway. Decrease this density, restrict access, or limit employees. If you have an area that is just the accounting people, nobody else needs to go in there, put a sign on the door saying restricted area, accountants only, or only if you work in this area of wind. That way you're kind of reducing the cross-contamination, and that helps. Put a phone so they can call into that office and say, hey, this is my question, versus going and talking to the person. I know it always was, get off your desk and walk in and talk to them, as you move throughout the day, make sure you're moving. But now that's kind of changed. You can still do that, but put a phone there, or have an extension, have something that you can make it so they don't have to go right up to them. Let's see, common areas, limit the use. You have your lunchroom, limit the use of how many people can be in there. Again, you are required to post a capacity limit at the doorway of going into your common area. Make sure that's enforced. Take some chairs and tables out of there so nobody can do that. Put, one chair at each table and say, this is the only person that can sit at this table is this one person. You've seen pictures of schools that have done that. Clean and disinfect before leaving. Put signs up that says, you are here, clean and wipe down before you leave, and make sure you have your hand sanitizer and your hand washing facilities there. Again, post at the entrance, occupancy of the space, physical distancing, hand washing, sanitizing, cleaning, disinfectant requirements. If you go on the EPA site, there's a link in this, there's a link here that will tell you the list of chemicals that are good to use against SARS, and you can find them. You might have to do some research and find them, but you can get them. Have that stuff there. That's going to help you. So your infectious disease preparedness and response plan. Not everybody has to have this, okay? You have to have this if you are classified as very high or high risk, or medium with 11 or more employees. And that's very important. It has to be 11 or more employees and a medium risk. If you meet that requirement, you have to have an infectious disease preparedness and response plan. The planning and the training requirements tied to the plan shall only apply to those employees that are classified as very high, high, and medium. Remember, we talked about if you have a low and you have a high, you have to do the same training on everybody. This is the same thing. If it pertains to them, you have to do the training. If it doesn't pertain to them, you don't have to do the training. Employer shall designate a person to be responsible for implementing their plan. You have to have somebody that knows something or can learn about the infectious response plan. They have to have somebody's name there who is responsible, okay? And it has to contain the names or the titles of the persons responsible for administering the plan. So this could be your HR person, it could be your safety person, it could be just somebody that's interested in this and wants to help with the plan. It has to provide for employee involvement. You can't just sit in an office and write the plan. You have to talk to your employees to know what they're doing when you do their assessment, and then you can help them. They can help you write the plan. Exposure risk level. It has to state what exposure risk level you're in for the task that they are doing. And again, where, how, and what sources of exposure they are being exposed to. What engineering and administrative controls are you using? Are you, it has to state in there, hey, we put barriers up between each of the cubicles so nobody can get within 6 foot of each other. Administrative controls, we very nicely modified our work shift. So now half the people come in at 8 and leave at 3. The other half come in at 12 and leave at 6. However you do it to make it work. Your work practices, what you're doing different that's going to protect people from the COVID. The PPE that's required. And again, remember when you have PPE, you have to do training on PPE, which consists of how to properly take it on, put it on, take it off, how to care for it, how to inspect it, and how to use it, and why you have to use it. That's all part of the PPE. You have to have some kind of a contingency plan for outbreaks, which means you have an outbreak, now you have 6 people that are out due to COVID, and they're gonna be out for 2 weeks, 3 weeks, whatever the case may be. How are you gonna deal with that? How are you going to work with the reduced workforce? How are you gonna handle if the supply chains are interrupted? Everybody knows toilet paper is disappearing again. How are you gonna work with that? You're gonna stockpile stuff so you have it or not? Your infection prevention, the hand washing. You're going to require people to wash their hands before they come into work, before they leave, before they go to lunch or break, before and after they take off their PPE. The housekeeping. Who's going to do the housekeeping, and how are you going to handle the infectious disease plan? If somebody is infected, where are you going to put them? Type deal. Your visitor education. If you have visitors coming to your site, you have salespeople coming in, how are you going to handle that? Where are you going to put them? Are you going to limit their access in? That should all be in your plan. Identification and isolation. Again, where are you going to put these people if somebody comes in to up to your boss and says, hey, I don't feel very well today. What are you going to do with that person? You need to find a spot to put them. We have one at my church called the COVID room. It's a classroom that we had. I emptied the whole entire room out. There's 3 chairs spaced, one on each wall. And that's our COVID room. If somebody's not feeling good while they're there, they go to the COVID room. It's the closest door to exit out of the building. It's a direct line into where most people gather at this point in time. So it's a good room. Look at the room that you're assigning for them to go, or the isolation area, and make sure that, hey, is this an easy way? Do they have to walk through the common area lunchroom to get out if they're not feeling good? If 911 has to be called, how are they going to get the person out? Where are they going to have to go through? Kind of look at that information before you assign where they're going to take them for isolation. How the employees and who they have to report if that they're experiencing symptoms of COVID. You need to have that in your plan. And it's got to cover subcontractors, temporary workers. Everybody has to be included into your plan. And then you have to say if you're going to follow CDC guidelines or the Commonwealth of Virginia guidance documents. And it's going to be compliance with mandatory requirements of any Virginia executive order or order of the public health emergency. So you put in there something similar to, will comply with executive orders in relation to health, public health emergencies, and that would cover it. Again, training, medium, high, and very high risk. You must provide COVID-19 training to employees. That includes the training on the plan. Okay? You have to provide that training. If they're lower risk employees, okay, so they're on that low risk, you can get away. You can use basic written or oral information. So you can stand there and you can tell them about coronavirus. You can tell them how it's transmitted, what the signs and symptoms are. And like I said before, if you go on to our website, we have that information already put together, so you can just print it out and talk to the employees. You can hand it to them, make sure they read and understand it. That's very important to do. They have to be able to read and understand it. So you have to give it to them in the language that they understand. So if you have Spanish-speaking employees, you have to make sure they understand it, so you would probably give it to them in Spanish. And there is multiple languages of these documents on our website. And if you have any questions, the VOSH consultation website is the top one. We go out and we do inspections, as in we help. There's no citations issued with what we do. Enforcement does. We are not enforcement. We are consultation. So we are there to help you. We will help you with programs. We do training, stuff like that. I think so far this year we've had 109 visits that involve some type of COVID information training, ETS standard stuff, I believe. The resources for our webpage is listed. You can go to VOSH programs and then click on about, or I think it is a VOSH, and it'll be there for coronavirus. You can get resources there. If you have a complaint form, we just went to an e-complaint form. So you can go on and fill out the form online and it's submitted to us. And if you have any questions, what we've done is created a online or an email address that just deals with COVID-19 questions. We can answer some, no problem, but we're finding that we have a lot of the same questions. So if the questions go into the COVID-19 question at dolly.virginia.gov email address, we take and compile them, and from there we issue the FAQs which are listed on our website, and that gets updated pretty regularly. But then we're not answering the same questions all over the time and spend a lot of time on that. We can do it as an FAQ or whatever the case may be. Does anybody have any questions?
And Tracy, I'll jump in here. I think there are a number of questions that we've received. So let me just go through those. And if you have additional questions, everyone, please use the questions tab. Go ahead and submit those, and I'll try to get through them one by one, and either Tracy and myself will answer them. So number one, and Tracy, can we share these slides with folks who are attending today?
I will send it to you in a PDF and you can have it. And actually all this information is right on the VOSH website. They can go, we have a whole training program that's done for low, medium, high. They can go and pull all this information right off of there too.
Great.
And they're a lot more in depth than what this one is, but yeah.
But I will take a copy of the PDF of the slides. I think I already have it, and I can go ahead and forward that out to everyone.
Okay.
Question number two is the infectious disease preparedness and response plan you're referring to the same as the VA Corp? You know, and to be honest, I'm not familiar with what the VA Corp is. Tracy, are you?
No, I'm not. The infectious disease plan is what is required in the emergency temporary standard. So I'm not sure what the VA Corp is. If that includes the same stuff and information that's required in this, you could, I don't see why you couldn't have one plan that covers both.
Mm-hmm. Yeah,
but I don't know what the VA Corp is.
Yeah, and I've been working on this issue for a while. I have not heard of that term before either. You know, the preparedness plan is required specifically by the emergency temporary standard.
Yeah.
So, and I imagine it will be memorialized if this becomes permanent in January. Next question is we've seen a rise of infections over the past month in particular. Have you been seeing more infections in the workplace? You know, more employers asking for consultation? You know, has, you know, your department seen a corresponding increase in activities?
So I can only talk about consultation. Again, I don't know about the enforcement side. For us, we have seen a little bit more coming in, especially the last month or so. People were starting to open up more and let us come in. We have a strict guideline. We have an assessment that we have to do before we can go to a company. We have to do an assessment to see what their exposure risk level is for us. And based on that, we'll determine if we can go out. I have seen more and more requests coming in, which is good. I think we did 20 visits in October, which has really gone up because prior to that, we weren't doing very many. We've opened it up to doing on-site visits, but we've also can do virtual visits. We've started to do them, and they've been working really well, especially if we can't get to a site. A lot of companies have been emailing us their plans, their documents, their programs, and we've been looking at them as well. So from us, I see a little bit of an increase in it. On the enforcement side, I couldn't tell you. I don't have access to how many phone calls come in or anything.
Gotcha. All right, next question. We are a Virginia-based construction company who, we are a Maryland-based construction company that occasionally performs work in Virginia. Can you confirm my understanding that we are required to report positive cases only for workers who have worked on sites in Virginia? So Maryland company, do they need to report positive cases for workers who have work sites in Virginia? Tracy, I'll let you take the first stab at that.
If they are in Virginia and there's a positive in Virginia, they need to report it to Virginia because it took place in Virginia.
Okay, so even if they're a Maryland company, so they're based in Bethesda, you know, they're a construction company of some sort, you know, and they go to a job site in Maryland. They have 2 employees there doing some plumbing work, and one of those employees, after working in Virginia, comes down with COVID. They need to report that to need to report that
Virginia.
positive test? Okay.
They need to report it in Virginia because they were working in Virginia. If they were just, and it doesn't matter where the headquarters is, like we have companies that their headquarters is in Texas. If they are working on a job in Virginia, they're a Virginia employer because they're working here. They're doing something here. They still have to follow all the Virginia rules and requirements.
So in that regard, so that company then is going to be required to follow the emergency temporary standard if it becomes permanent, all those requirements. So again, if it's a cleaning company based in Bethesda doing work in, doing work in Maryland and Washington, D.C., and once a week they have employees coming to Virginia, they are considered a Virginia employer and need to comply with the emergency temporary standard.
Yep. It's no different than the Virginia has unique standards for, say, tree trimming. If it's a tree trimming company that's in West Virginia and they come into Virginia to work, they have to follow the tree trimming standard that's unique to Virginia.
What's interesting there is I would bet that 9 out of 10 companies based in Maryland or Washington, D.C. or West Virginia have no idea that they need to comply with these emergency temporary COVID standards for work that they're doing in Virginia.
I'm sure.
Yeah.
I'm not arguing with that. But we do have
guess,
consultants that are in Manassas, and they do go out and they do help other employers. So I guess the due diligence on their part is to see if they are required to follow it. The way I look at it, it's no different than if I'm driving my car in Virginia, I have a license in Virginia, I drive to New York, I have to follow New York state speed limit, which is 55/65, versus Virginia, that's 70.
Mm-hmm. That's interesting. I guess that's one reason why we're doing this webinar, is to really try to educate as many people as we can. But it's one thing that I've really encountered, in the past several months, is that a lot of employers still don't know about these requirements, and once they do find out about them, don't necessarily know how to fully comply, which I'm sure is something that you've seen over and over again also.
Yep.
Let's see, another question asking for the slides. I'll email them out afterwards. Next question, what about a policy requiring a negative COVID test as a condition of hiring, even for an asymptomatic employee? So Tracy, have you seen anything that, one way or the other, whether as a part of the employment hiring process, you could have require a negative COVID test? It's probably outside the scope.
I have not seen that.
Right.
Yeah,
And
I have not seen that.
Because again, I'm on a day-to-day basis, my area is employment law, is the EEOC, the Equal Employment Opportunity Commission, the federal agency governing employment law and federal employment laws, has said that you can do that as a condition of employment. It needs to be done on a non-discriminatory basis, but you can have that negative COVID test as a requirement as part of the hiring process. Again, it has to be done in that non-discriminatory basis. So you do it objectively across the board. You need to be very careful in that regard.
I don't think that's something I would want to do.
No, it's something that some employers are doing, especially, if it is a workplace that would be susceptible to spread of COVID based on the working relationship. You're working in a factory setting and you have some social distancing, but it's hard to do it fully. You want to make sure that you are careful in who you bring in. So in certain circumstances, you can have that testing as a job requirement.
Conditional. Okay.
Next question, should a risk determination chart be saved on file? So should an employer, save their risk determination chart?
Their hazard assessment has to be kept and saved, yes. And that should be part of your infectious disease plan. But your hazard assessment, you're going to want to save that. Because at any point in time, it can change. So you want to go back and change it and update it as needed.
Okay. Very good. So here's a tricky question. Our office has been
Yeah.
trying to follow all guidelines. Problem is the boss himself, who is the owner of the business, landlord of the premises, etc. He'll say one thing, but actions don't back it up. How do we employees confront an employer who is wishy-washy, won't enforce the policies?
File a complaint.
Yeah, I think I was going to answer the same thing. You have, right in front of you this complaint form, the link to
Yep.
it. Um,
File a
yeah,
complaint.
yeah, I think that's what you do. I think are the complaints anonymous?
We have to know the company and the name, and they do some anonymous ones. If they have questions, they prefer that they have a contact name, but they can make it so the employer doesn't know who is filing the complaint because we don't tell them. But
Yeah,
if they want any type of a follow-up, like, hey, we sent a phone and fax and this is what we found out, that information reply back to them, they got to put their name and address,
hmm,
or at least a contact name, so we can get back to them and say, this is what was established. We determined that there was no hazard, or there was a hazard, or whatever the case may be.
yeah. And just as a disclosure, it's potentially subject to freedom of information request.
Yep.
But the emergency temporary standard does provide protection from retaliation, so that
Correct.
if the employer took any actions against the employee for reporting these violations of the law, there can be liability, as there is for other health and safety employment laws for retaliation. Hopefully it wouldn't come to that, but it is something that is there providing protection. This is a question, something about being in Roanoke, and it's the same information. I assume if you're within Virginia, it is the same information and the requirement across the state.
Yes.
Next question. With the holidays around the corner, if an employee informs HR or supervisor that they'll be traveling out of state, when they return from PTO, does that require a quarantine of 14 days before returning to work? And I'm not sure that's really a question for you, Tracy. It's more really an employment law matter.
Yeah, that's kind of that has nothing to do. I can't answer that.
No, so
If
that's
you're
not really dealing with the emergency temporary standard, but it is an issue that a lot of employers have struggled with. You have,
yeah.
let's say you have a 28-year-old employee, or a 48-year-old employee who's going to a wedding, going to Vegas for a wedding, and you're unsure as an employer whether or not there's going to be social distance. What is your responsibility as an employer to the company and all of those employees? That's not an issue that is dealt with by these Virginia emergency temporary standard laws, but it is something that the employer needs to consider. And I think you fall back to it's an employment relationship. 99.9% of the time, it's going to be at will employment relationship, and the employer is allowed to implement objective policies to protect the company. You can put
And
in a policy that says if you go away and you are at risk, there is a mandatory unpaid 14-day quarantine period.
yep.
And if you don't like it, you can be fired.
Sorry. So New York they have shut down basically a lot of stuff, and they just put out, if you are traveling from out of state for the holidays or whatever, if you're traveling from out of state, you are required to get a COVID test 3 days before you come to New York. When you get to New York, you have to quarantine for 14 days, as in you have to be in your own living area with your own bathroom. Food has to be left at your door. At the end of the 14 days, if you don't have any signs or symptoms, you can come out. However, they put a little thing in there that says if you take your COVID test 3 days before, you get to New York, you quarantine for 3 days, you take a second COVID test and that's negative too, then you don't have to quarantine for 14 days. That's what New York just did.
Yeah. So, and I think, as we go forward the next month or two, it's more likely that other states are going to be putting in similar policies. but on
Yeah,
a employer by employer basis, you know, it's something
that's
that we
hard.
as a law firm have been helping different employers put into place. You know, what is best for your company to keep your employees safe and keep the company functioning. And some companies have put policies like this in place. And some companies that I've worked with, an employee comes into the workplace and isn't wearing their PPE, isn't taking necessary precautions, they've been fired. You
Yeah.
know, and you're within your rights to do that as an employer. Let's
Mhm.
see, next question. What would count as a positive in each state then? Maryland and Virginia. I'm not sure I understand the context. It must have been asked as we were going along. You know, I think the positive is, as it relates for VOSH and reporting purposes, is, you know, a positive that, you know, could correlate with the workplace. How long should we keep the training records, Tracy?
Forever. In my own personal opinion, I go forever. You want to keep them for at least 5 years, at least, because if somebody was to leave, come back, say they didn't get trained, they got trained, whatever the case may be, I would do a minimum of 5 years. When we go on site, we ask for at least 3. I am a huge believer in you keep training records forever, because you never know how long something's going to be coming back. Kind of like they say you need to keep a safety data sheet for the however long the employee's been there, and then 30 plus years. I just basically always come down to keep training records forever. If
And
the employee dies and you know about it, fine. Then, you know, if there's no chance of a litigation or anything, okay. But I'm just a firm believer in keeping them forever.
yeah, and as legal counsel, I'll say I think that it sounds reasonable. If you are going to get rid of them, make sure it's part of a well-documented, you know, employment document retention policy, you know,
Yep.
and that you're utilizing. I'm not sure if this is a question for you, Tracy, or not. What is acceptable as far as face mask, as a mask or face shield? You know, I assume as long as it's proper PPE, you don't have a opinion in that regard.
I really don't have an opinion that's a professional opinion. The CDC has done a lot of research on face shields and masks, and the mask has covered, you know, your nose, your mouth, and under your chin. You have to do your hazard assessment and see, and do your research. I'm not going, I cannot in good conscience say face shields are not good, masks are not good. It's up to you and what's going to work for your facility.
Yep. Next question. Let's see, if you live in Virginia and travel to North Carolina, can your employer tell you that you cannot do so, even if it's just for the day? So I guess that's what we were talking about. You know, you live and work in Virginia, you want to go visit family, you know, in North Carolina. Can your employer tell you that you can't do it? You know, and I think that's more of an employment law question. And I think the issue there is, you know, an employer can develop reasonable and objective criteria trying to keep the company safe. You fall back upon its at-will employment. So within those parameters, as long as something is applied in a non-discriminatory basis and is objective and reasonable, you know, something like that could be possible. Now, that being said, I think a blanket policy saying you can't travel out of state is probably going to be overly restrictive. Now, would it be illegal for an employer to say that? I don't think it would be necessarily illegal. Now, it doesn't mean it's something that would be smart and something we'd recommend, though. There's a question here, will employers need to have a policy regarding vaccination once a vaccination is available? Tracy, I don't know if you all have an opinion on that yet.
Not one that I want to share. How's that?
And just, the EEOC has issued guidance as it relates to flu vaccines, and whether or not an employer can require employees to take a flu vaccine. So some of the analysis for that could be similar. And within certain circumstances, employers can have some of these requirements. But again, I think it's something that, to be honest, you should call me, or if you have a relationship with another employment law attorney, you should be speaking to an employment law attorney about your policies, what you can and cannot do as it relates to not only COVID, but also bringing your employees back to work. What happens about a virus, or a vaccine, and can you require them to have a vaccine? There was a question. Yeah, there was a question about hazard pay. I think a lot of the hazard pay has been provided to employers sort of at the discretion of the employees. I have not seen that much more on that. I don't know if you have in that regard, Tracy. No. I would imagine no.
Nope.
Another question we had is, what level of auditing or compliance monitoring is being done in the coming months? And just from my perspective, and Tracy, I think you probably have a better answer than I, although I guess there's a division between consultation and enforcement. There's really no proactive monitoring of employers. It's more complaint driven, correct? Or are you doing some random audits also?
No, they have, so what we have is a schedule of inspections, and it's a programmed inspection list. So there's companies on that. They go out, and I'm sure that they're adding COVID to it and the ETS to it. If they see something, they can. There is that line between consultation and compliance. We do not cross that line. So I couldn't tell you. Any place that we go to for consultation, we do not share that information with enforcement. It is pure confidential. My programs, we're the ones that are proactive, because we will go out, we will look at your policies, we will help you. But you have to request us to do that. Enforcement doesn't have to. They can go off of their program schedule list and go into a site and say, hey, okay, I'm looking here, I'm here for the program inspection, and I'm going to look at this, 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 and this, and the ETS standards and all that stuff can be part of that. My guys, you tell us what you want us to come out and look for. We will come in, we will talk to you, we will help you. There's two totally different things. So we are very proactive where they are reactive.
Mm-hmm. Have you heard, and again, this is sort of a question that might not be within your parameters, penalties that are being doled out to employers for non-compliance? So you gave information earlier on complaints and enforcement actions. What have you heard about penalties to those employers for non-compliance?
I have not heard if any cases have been settled yet, so I can't answer that question. On my side of it, I have some of the consultants have issued, and I'm going to call it a citation, but it's not a citation because we don't issue them, but they have given the employer, when they write up the report, they have cited them for not complying with the ETS, social distancing, employees wearing masks and stuff. Again, we don't offer any fines. We give them the stuff and say, here, you have 90 days or whatever the time frame is to address it and fix it. Because part of my service is we require them to fix any violations that we see. So if they're in violation of the ETS, we're requiring that they fix it. So we're bringing it to their attention, saying this is what it is. We give them recommendations on how to go about addressing it and fixing it. And they send us information saying that they abated the issue. But for violations as in fines and stuff, I don't know.
Great. Very good. One follow-up on sort of hazard pay. I know that just recently there was Governor Northam. He authorized hazard pay for some home healthcare workers. So it was, and I'm looking at the exact date here, but a payment of $1,500 will be available to an estimated 43,000 home healthcare workers who were working between March 12th and June 30th. So there is some hazard pay that will be available for different employees. I would look, and that was on October 15th that was issued. So I would look at your industry's particular, look at your industry to see if there's anything applicable for you all in that regard. With that, it is now 11:06, so we're a little over our time period. I think that we are gone through most of the questions. You know, I will say one more thing. I'll just say thank you to Tracy for helping us here. It was great to have her involvement and expertise. So thank you, Tracy, so much for that.
You're welcome.
You know, and just as the host, you know, I appreciate everyone signing up today. Hopefully it was very helpful for everyone. There is more information on our website, gcpc.com. And we've helped clients with automating some of the requirements for compliance and have created a form generator that individuals can use. So please take a look at that also. It has been helpful for a number of our clients. So with that, Tracy, thank you so much. Any last parting words of wisdom?
Nope. Thank you so much for inviting me. I actually enjoyed it. And if there are questions, please let us know.
Excellent. Thank you, everyone. Take care and please follow up. I will send a follow-up email with some of this information and a copy of Tracy's presentation. Thank you. Take care and goodbye.